This is a typical case of fowl pox. Now, birds that are not vaccinated are most likely going to come down with fowl pox, and this disease affects older birds, okay, and layers are mostly affected once they are not vaccinated, during their before they start laying, okay. So you vaccinate your birds against fowl pox from week 9, between week 9 to week 12. So from that week 9 to week 12, make sure that you vaccinate them against fowl pox, okay. So for the vaccination, you use fowl pox vaccine, and this is the instrument you use in vaccinating it. This is called lancet. So you vaccinate this by stabbing the birds on the wing web. The wing web is one fenestrated part of the wing. So once you just extend it, you're going to see the wing web. Then you now stab. You stab. Just dip this inside the vaccine. Then you stab. You stab it, and that is for chicken, laying birds. That is pullets and broilers that will stay in your farm for like 4 months and above. So you can just vaccinate them against fowl pox, right? But for turkey, if you want to vaccinate against fowl pox, you don't stab on the wing web. You know why? The reason is because turkey, if they want to sleep, they sleep, folding their, as in, they just bring their heads, under their wing, and that is how they sleep. So if you vaccinate through the wing web, the vaccine is most likely going to enter the eye, the nose, and the rest of them, and it will cause problem for the bird. So for turkey, you vaccinate by injecting it on the thigh muscle. Okay, so that is how we vaccinate for that. So if these birds now come down with this fowl pox, there are drugs you are going to give them. There are drugs in the market. You have post clean. You can give them pox free. Okay, and a good number of them in the market. Now, this fowl pox is also important for us to know that it comes in two forms. We have the cutaneous form, or you call it the dry form. That one is the one that you normally see. You see it on the head region, the head. You just see legions of pus, like you see swellings there, and that swelling contains pus. Once you just incise it, you see pus coming out, right? Now, there is also another form. You have the dry form, or you call it the cutaneous form, and also the wet form, or you call it the diphtheritic form. So for the wet form, you will see the wet form in the mouth, in the esophagus, and also in the trachea. So these three areas, these are the areas you are going to see the wet form of this fowl pox. Okay. Why for the cutaneous form, you just find it on the head. Okay. All right. So if you are giving this drug is going to take care of most likely the wet form, the ones that they are not seeing. To take care of that one, as well as the ones on the head. So the drugs is going to help. You know that viruses are not treated. Any viral disease, the treatment is always slim. You don't treat viruses. Okay, that is why we're having problem with HIV today. Okay, so for the cutaneous form, the one you see the pus on the head and the rest of them, if it is the one that you can see the pus, that the pus are swollen up, and that's the lesion is swollen up and it contains pus, you can incise it. You can use something to cut it open, then you press out the pus. Use your finger to press it out. Then use iodine tincture to swab the area to clean up the pus. Then after cleaning up the pus, you can use hydrogen peroxide. If you don't want to use iodine tincture, you can use hydrogen peroxide, to debride the area. Okay, you debride it. After debriding it, you can use normal saline. Normal saline contains water and salt. You can use normal saline to flush it. After flushing it, then you can now use cotton wool with your methylated spirit and just clean it up. Right. While you are giving them you're giving the birds the drug for fowl pox you get from the market, posa clean, pox free. You can also help the birds by doing this, you know the lesions on the head. You debride, you remove the pus, and so that the bird will recover quickly. All right. Now, any bird that come down with this disease condition, once it recovers, it will not come down with it again. It develops immunity against it. All right. So once the bird come down with the disease and it recovers, there's no point you vaccinating the bird again, because it has already developed that immunity.